Hello everyone. On behalf of the Hindu and Rotary District 3234, I welcome you all to today's webinar, The Last Mile in the War Against Polio. As we approach World Polio Day on October 24th, this session brings together leaders who have been at the forefront of Rotary's decades-long mission to eradicate polio worldwide. Even though polio has been 99% eradicated globally, the journey isn't over yet. Today, we'll explore what it takes to end it completely. Audience, please feel share to share your questions in the chat box. We will be answering them towards the end of the session. Today, I'm delighted to introduce our speakers for this evening, Rotarian Vinod Saraogi, District Governor, Rotary District 3234, Rotarian Michael McGovern, First Rotary, past Rotary International Director and International Chair of Rotary's PolioPlus Committee. A warm welcome to both of you and to everyone joining us online.
Thank
May I
you.
now invite, yes, sir. May I now invite District Governor Rotarian Vinod Saraogi to deliver the welcome address. Over to you, sir.
Very good evening to one and all. I thank the Hindu newspaper, which is a 147-year-old newspaper and the leading publication throughout South India. It was great that Hindu came forward to join hands with Rotary and cover our war against polio. Today evening, we have the learned speaker in Michael K. McGovern, who is the international chair for PolioPlus committee. We have the senior journalist Athira Elsa Johnson, who is going to moderate the discussions. I bring greetings from Rotary International District 3234. We are a Chennai based club and with 82 clubs and 3,400 members. That is our district. And this year, we have taken it up in a big way to promote the campaign and sensitize the issue of end polio. Friends, polio has been the biggest effort of Rotary for the last 40 years. Starting in 1985, the PolioPlus campaign has spread across the world, and when in 1985 there were 3.5 lakh polio cases worldwide in 125 countries. Over the years, the the effort of Rotary, along with partner organizations like WHO, UNICEF, Bill and Melinda Gates Foundation, through all these efforts, we have brought the world almost to end polio 99.9%, and just two countries, Pakistan and Afghanistan, have reported cases of polio. Recently, we had a very big event in our district where we had created the formation of End Polio with the use of 4,000 rotractors, and we had uh, the RI president Francisco present for the function, and we had created a mega image of End Polio, which was greatly appreciated by the RI president. This year's campaign, we are doing sensitizing the effort of Rotary. We have selected 8 metro stations where multiple clubs are going to highlight, sensitize people about the polio campaign. We have done a drive for collecting uh, funds for the polio foundation, and we are also planning the polio immunization drops to be given on the 8th or 9th of November, along with the Corporation of Chennai. We fully understand that we are now in the last mile, the war against polio, and it has to be a continued effort by Rotary and its partners without relaxing, such that we are able to end this disease from the face of the earth. And that will be the biggest victory of Rotary once we are reaching that milestone. And believe me, Bill and Melinda Gates, Mr. Bill Gates, is constantly in touch with Rotary to put all out effort, and Rotary with its grassroots uh, members in every corner of the country, they are reaching out to the governments and they are putting all efforts to reach out to the remotest child anywhere in the mountain terrains, in the desert terrains, such that we do not miss out even a single child from immunization. And even those countries which are polio free, the vaccination drive continues to be there such that no new cases erupt from any part of the world. So, uh, from RI District 3234, and with the effort of Rotary worldwide, we are putting our utmost effort. We are sensitizing the public. We are not relaxing at any moment, and we will do the best what is possible. We will hear from our leader, Michael McGovern, how the Rotary International is viewing the End Polio campaign. So, with this, I pass it on. I thank you for the opportunity. I will definitely answer any questions that are put forward. And I'm very delighted and thankful to the Hindu for doing this webinar.
Thank you, sir. Thank you. Before we move into the global outlook, let's also, like adding to what you said, look briefly at the context, the story of how India built the foundation for polio eradication through early community and Rotary-led action. In India, Rotary played an important role in supporting immunization and public health initiatives well before polio eradication became a national mission. Through early partnerships between Rotary clubs in India and abroad, large scale vaccination campaigns were organized, helping build systems for vaccine delivery, logistics, and volunteer engagement as well. And by the mid 1980s, Rotary's PolioPlus initiative brought these efforts together under a single global vision. The program formally took shape in India with strong collaboration between Rotary International, the Ministry of Health, and state governments, including early projects in Tamil Nadu that demonstrated how community participation could make a mass immunization possible. And in 2014, the World Health Organization certified India as polio free, a milestone achieved through decades of dedication and collaboration. Challenges in eradicating polio. Over to you, sir.
Michael, it's your turn.
Oh, thank you. My voice keeps cutting out, and my photo keeps cutting out. So, could one of you respond that you can actually hear me?
Yes, sir. We can hear you. You may continue, sir.
Can you hear me?
Yes, yes, we can hear you.
Can you hear me? Can you hear
Yes,
me
sir.
now?
Yes, yes, we can hear you.
Yeah, my connection seems very, very. Is it okay on your end?
Yes, it's clear from our end. Do you want me to? Do you want me to share the slides? Are you there? I think we have some technical issues going on. We lost him in a bit. Let me.
Let's come back.
Yeah, yeah,
Yeah.
Yes, Michael.
yeah.
You're back.
Can you hear us, sir?
I-
Yes, sir. Shall we start again, sir?
Maybe he can talk without the image, it will be clearer.
Is this connection better?
Yes, sir.
Yes.
Much better. Shall we start again? Okay. You may continue, sir. Mr. Michael, are
I'm
you
only
there?
connected to you about 3.
We can hear you, sir. Sir, could you please try connecting now? Are you there? Mr. Michael, are you there?
Yes, sir.
Uh, Mr. Vinod Saraogi, could you please take over? Yeah.
Yes.
Okay, sir. Okay, he's connected from his other.
Yes, yes.
Is this connection any better?
Much better.
Okay, I'm not. I'm,
Mobile.
much better. I'm now. I'm now on my telephone. Let me turn my sound down. Yeah, is that good now?
Good. We can hear you. Please go ahead.
Hello?
Yeah, please
Yes,
go
sir,
ahead,
we can
Michael.
hear you. Please go ahead.
Yeah, can you hear me now?
Yes, sir.
Yes.
I can see you and I can hear you.
Yes.
All good. Please continue,
You can
sir.
hear me. Good. Well, why don't I begin? If you could put my slides up, that would be
Yes.
wonderful. Sorry for the poor
Sure.
image quality on the phone. It's just not the same. Well,
Your
good. Well,
slide
thank you
is up
very much. And I
slightly, please.
apologize for the connections. I think it must be something on
No
this
worries.
end because my power just went out too. which is very strange. So not too sure why that happened, but nonetheless, I'm on a cellular phone connection, so we'll see how that works. Anyway, very pleased to be with you. I didn't hear the introduction, but I thank Governor Vinod, and I thank you, the moderator, for assisting as well. What I do have is a couple of slides today, and I want to say that at the outset that we're making very good progress. We're very pleased with the progress. There are a few issues, but we have a number of priorities, and the number one priority is that we ensure that we have Rotarian engagement at this critical time in polio. We have about 60% of the club, 62% that give something to polio, either through individual club contributions or through from individuals themselves. That's very positive. Secondly, uh, we'd like to have Rotarians engaged in some of the polio walks, the other things. India set such a wonderful example of what could be done by eradicating polio in the country, and by as well, doing so much to bring awareness and attention, and that helps in every country. It helps with funding. It helps with encouraging folks to continue to get immunizations, and I think India is a great example of the work that was done by moving to the inactivated polio virus, so the shots in the arm over the oral polio vaccine. The government assumed responsibility. I don't know how many of you are aware, but when the government of India first transitioned from oral polio vaccine to the IPV, they asked for a contribution of $25 million, and it was from the whole partnership, and we were happy to do that. But ever since that time, the government there has assumed total responsibility for the cost, and that's much appreciated. We also know that we need better accountability. We want the slide before this one. We also need better accountability from our partners. Sometimes they're not achieving the objectives, and we need to do a better job to ensure that they're achieving the objectives. We also need to continue our advocacy around the world. And interesting, just before this call, when I didn't have any technical difficulties, we had the advocacy advisors or Rotarians from virtually around the world who were on the call to see how they can work with the governments, ask the governments for money, and all that's very positive. So if we move to the next slide, I mentioned Rotarian engagement. Uh, in August, the person in the middle with the tie on is the president of Rotary International, Francesco Arezzo. The very first trip he made as president, after he became president, was not until mid to late August. He became president very suddenly, very unexpectedly, and we asked him. He became president like a week before the Calgary Convention, or at least knew he was going to become president. And we asked him at that time, would he undertake a polio visit to Pakistan? He did that. He did that, and then he came to. I believe he was headed to Chennai afterward for the big membership seminar that you had there. That I hear was nothing but a tremendous success. But anyway, this was the first time he ever immunized a child, and it's important to have his involvement. And I think if you look at the child in the lower left corner, he was the next one to be immunized after the young girl that he did first, and this little boy was all ready to get his immunized shot. And I think if every kid was like that across the world, would be so much better off. On the next slide, you'll see other examples of Rotarian engagement. I think. Are we moving to the next slide? Yeah, there we are. This slide, interesting enough, it shows a group of Rotarians who have just been on a walk. The woman on the right is Jessie Harmon. She is now an immediate past director of Rotary International, and she climbed to the base of Mount Everest to bring attention to end polio, to raise money for ending polio, and very successful. She's not a young woman. She's middle aged, I would say, and she's just so impressive and impressed me so much that she climbed to the base of Mount Everest. And The other young girl with the flowers, she had just been immunized, and the man on the left is Bob Scott, who was a very much he led the International PolioPlus Committee when he worked with Deepak Kapoor and so many others uh, to help fund and encourage and bring about your great achievement of a polio-free India. The man in the middle, sadly, is a person I first met him up in Islamabad, and he was walking toward me, and he had a couple of walking sticks, and I thought this man is a polio survivor. Well, he the man who walked up to me was a polio survivor. He survived an attack on a polio resource center, and the man that walked to me with his brother, who's still working in the polio program, despite the fact that he had lost his brother and he himself had lost use of his legs. On the next slide. Yep. One of the things that we're trying to do is to in addition to get support from Rotarians around the world financially, is also support for governments. And I don't want to single out the U.S. government, but at the same time, there's a lot of questions about the United States government on so many areas. I hear India in the news, even this morning, with some issues that the president here was raising involving Russia. But anyway, there's this sense that the U.S. government has somehow stopped support. Well, the reality is, as you can see from this chart, is that since the time just before polio was eradicated in India, the U.S. government has increasingly given support. They've never they might have gone down with a little blip one year or two, but basically, right now they're supporting it at $265 million a year. The current budget has that amount, and even though the U.S. government is shut down or supposedly shut down, they're still supporting the 265 million in both chambers of the Congress. So that's positive, good news. And I think while the United States government sadly is not giving to the World Health Organization, I think you can see that they're not abandoning vaccines, even though there's some rhetoric to that effect from a key individual. But that's positive. So going forward with the continued support of countries like Canada or Australia, Saudi Arabia, in particular Germany, and continuing the U.S., the U.K., it's going well. Yes, funding's gone down. Yes, there are challenges, but at the same time, it's not as bad as people think there. On the next slide, you can see soon. It's very different doing this on a phone. Uh, yeah. So, where are the recent polio cases? I get that question a lot. We have two types of polio cases now. One is the wild polio virus, which is the traditional one, and we also have polio variant cases. India is fortunate; it's not getting any of either type of case. But even in some other countries where we abandoned wild polio virus, there's low levels of immunization. And what's happening is when other kids receive the oral polio vaccine, they secrete it, and other kids, because of poor sanitation and other issues, sometimes pick up that virus. And you can see we've had a particular problem in the Horn of Africa, in Yemen and Ethiopia. On the left, you have columns and listing of countries where we've had all types of cases in the last 12 months. On the right is the column of where we've had cases in the last 6 months. You'll note that, obviously you would expect the numbers on the right to be half of what they are over the last 6 months is 12, but you can see it's only like 25% or less. There is a problem with reporting in Yemen, and Yemen stood out last year as the spot with the most number of cases. This year, Pakistan is up over a quarter of the cases in the world. Afghanistan doesn't have that many cases, but we have significant challenges there in that the de facto government, the Taliban, is not allowing house-to-house vaccinations. They're allowing something called site-to-site vaccinations, which fortunately has been interpreted a little bit better than you might expect. At first, they said only mosque to mosque, but then they said we could do site to site. But the site to site involves going, on a lane, a street that is like where they can be serving only like 5 houses at a time, and that's not considered house to house. So, with the good work of UNICEF, funded by Rotary, totally by Rotary in this case, they do advance noticing, putting up posters, and having town criers, and you name it, and they go to those streets beforehand, saying the polio workers. Frontline workers are going to be there at say 10 a.m. on such and such a morning, and when then they go and they make a little noise, and the people come out of their homes. It's working much better than expected, but this is the situation. It's a downward trend, but we're not quite there yet. In Pakistan, we still have problems with militancy. As India is well aware, there are some troublemakers in that country, and while they make trouble with between the countries, they also make trouble in their own communities, and that includes attacking polio workers, and it involves, government officials who are unwilling to have the polio drops provided in their communities. Like in India, back around 2010 and the years just before that, we try to work very closely with local officials, but despite the best efforts, it's not happening everywhere. And in Africa, the problem, as I mentioned, is again militants. It's areas, around Yemen and Somalia where there's instability, political instability. While the Democratic Republic of the Congo cases have gone down, there's still instability in that country. And you can look the list, particularly on the right, but also on the left, is if you had to list countries in the world where you have challenges and problems, I would mention Gaza. Obviously it's been a very sad situation, and we were fortunate that Rotary, through the support of Indian and other Rotarians, was able to support uh, that campaign. And until the recent ceasefire, it was the only ceasefire that had successfully held, was the one to provide polio drops. So I think we can feel good that we're doing that. And there was a tremendous response from the community, despite all the challenges and despite the danger of going to healthcare centers, which it couldn't be done house to house. Despite the danger, it was still very successful. If we move to the next slide, you'll see this was what happened in India in the reduction in cases over time. You can see around 2009. I might have that date a little wrong, but on the far left, you can see there was a big spike in cases. Then it went down. Then it went up. Then it went down. But you look at that big valley that's about a third of the way across, not quite a third, and you go up to the top, and what those bars are up there is when we were having national immunization days and subnational immunization days and mop-up operations. In the area where we weren't doing, or the program was not doing, the full complement of NIDs and SNIDs, subnational immunization days, we'd get a spike in cases. But fortunately, as India progressed at the very end, we had a spike at the very end, and then in the course of 2 years, it dropped down to 0 cases. So, we're unfortunately accustomed to seeing spikes, and we hope, at this point, we're going down. On the next slide, you see the particulars for the number of wild polio virus cases. And you see that this one, I went a little further in the term of the number of years. The green on the far left is India. And you can see, as I just mentioned, how quickly suddenly polio disappeared. And that was particularly because of work in Uttar Pradesh and Bihar, where we were having quite a few cases, where with the strong support from Rotarians, through the polio eradication program, were able to go in there to convince the religious leaders and others that this was important for their children. The blue area is Pakistan. They tend to spike every 5 years. What's good news is if you look at the last 3 spikes, the spikes have been lower. The spikes coincide almost exactly with the periods of when they had Pakistani elections. And the reason for that is that every time they call an election, they basically fire everyone who's in any position, including in the polio program. So you start off, you end up with acting individuals and they're just not as good. They're not organized. There's they're caretakers, and as a result, you see a spike in cases. So it's the trend is continuing. We've had last year we had 99 wild polio virus cases. This year we're at 35, with the six of them in Afghanistan and 29 in Pakistan. So they're interesting numbers. Sadly, we're still getting polio cases. The next chart, the next slide. Uh, there's questions from time to time. What can clubs do? Obviously, we hope that every club participates, not just 62% worldwide. But it's there's different abilities to give between different clubs at different places. But we would hope that every club would be able to say, I was involved with the end of to polio, and the guidelines that are shown in this slide are the specific ones that they're global. Smaller clubs, maybe obviously, may not be able to do the amounts, but any amount of rupees is wonderful, and greatly accepted. We also, I don't know if we have it in your district, but there's something called the PolioPlus Society, and that also is for folks that agree to give the equivalent of $100 a year in most districts. But again, I'm not sure if yours does that. So any support's appreciated. The next slide. Uh, and this is the final slide. We have a number of quotes that are here, and I won't read them exactly because, quite honestly, I'm on a phone and I can't read it. But I'll do it as much from memory. On the left, this actually paraphrases a quotation that President John F. Kennedy made in 1961. And what he said back in 1961, it was a speech at a university in Houston, Texas. And he said, "We shoot for the moon. We shoot for the moon, not because it is easy, but because it is hard. And we'll bring together our skills and our abilities to get this done. We won't give up. We'll continue to fight to the end, and we'll get it done. And we just won't give up." And I look at at the bottom of this quote. I have your club. Can your club say that in not only in polio but everything? But do you have what they call a moonshot? Do you have a goal in your community that's more ambitious than you think you could ever accomplish? And that's what polio has been for Rotary. It really no organization in the world has ever, that's not a government, that's not a church, it's not a religious entity. No one has taken on a project like Rotary did to eradicate polio. It was Rotary that actually brought the Gates Foundation to the vaccine world. They hadn't been doing it. There was some Rotarians who approached Bill Gates' father. He headed the Gates Foundation at the time. And it was Rotary that brought in the World Health Organization. And you see this quote from Dr. Tedros, who's the head of the World Health Organization, talking about Rotary's tenacity and its audacity. We were willing to take it on. So many leaders there. Raja Sabu, going back to in India, and so many others that and obviously Deepak Kapoor all these years. And I shouldn't start mentioning names because I'll leave out a lot of important contributions of individuals. But it was polio would not have ended in India if it wasn't for Rotarians in India. I think you need to know that. You need to be proud of it. But just like here in the United States, where we've only had one of the vaccine cases a couple of years ago, we don't give up. It's important to get this in the world. We say it's only a plane ride away. That case that came back to the United States, the individual didn't go anywhere. It was someone else who brought it in by an airplane ride. But again, the individual didn't keep their immunizations up, and I would hope with Rotarian engagement in India that one thing that you might do is have as a speaker at the club your local health officials. Keep up on what's being done. Ask them to present to you the vaccination rates, because if you even with most kids now, the great majority getting the IPV, there are still some who are missed in India and elsewhere, and it's helping to build the immunity levels to make sure that polio stays out of India. Catherine Russell, the head of UNICEF, also mentions the frontline workers, but she also indicates that it's Rotarians who had the audacity, had the skill to get this done. UNICEF also gave a presentation to Rotary last year, saying that we were their most valued partner, and I think that says something. Sometimes you wonder about Rotary and its influence, and not everyone knows this. Although India, it's Rotary's better known than almost anywhere else because what the good work that you do. But it's. We have to finish this. We have to get it done. We need to move on to other things. And if you look back at the quote where I'm paraphrasing President Kennedy, it's important that we do polio, but it's also important that we do the other things. We need to be figuring out now at the club level, what is the next big thing after polio? For a lot of you, it's literacy, it's water and sanitation, it's other projects which are malnutrition, so many other things that are done in India. But the next polio program could very well come out of a Rotary club or a Rotaract club in India, or even a community Rotary Community Corps. It's all of those entities that are going to develop the next polio project. So I remain optimistic. Yeah, there are challenges. Yes, some of the governments of the world, the United Kingdom and Germany, are reducing their amounts. Yes, the United States government, by not giving the World Health Organization, is not helping. But you got to keep India doing what it's doing. It's doing things right. It's doing things right in terms of having the IPV. But India needs to recognize that you're a global player. Rotary, obviously the second largest Rotary country, and the work that you do is greatly appreciated, greatly valued, but most of all, greatly important. There's 20 million people walking on Earth today because of this effort have been started who did not become paralyzed or did not die as a result of the vaccine uh, being taken up by kids. We've gone from 350,000 cases of wild polio virus down to, as I mentioned, about 35 so far this year, although I haven't looked at today's report yet. There might be one or two there. But anyway, I want to thank you, and I apologize for the poor quality. And I have one hand that is steadier than the others, and I apologize. I've had the phone in my hand the whole time with the more unsteady hand. So if you see a little shaking, I apologize for that. But it's a great honor to be with you today. For Gopi to invited me, and to remember the Rotary torch that started there in your community. I heard the other day that it was actually going to be for sanitation, but they decided to do it for polio, and you know, praise the Lord that decision was made. It's been so meaningful. It was at the same torches were at the Calgary Convention again this year supporting polio. So I thank you. Wonderful to be with you, and I look forward to any questions that may follow. Thank you very much.
Thank you, Mr.
Thank you,
Michael.
Michael.
Uh, Thank you, Mr. Michael. That was very detailed and pretty insightful address. Shall we move to the questions from the viewers?
Absolutely.
We'll be taking a few questions from the audience now. So if you haven't yet, please post your questions in the Q&A box. Moving on to the first question. How do factors like conflict, misinformation, and vaccine hesitancy impact eradication efforts? That's the
It's
first.
was that for me?
Yeah.
Yeah, that's a good
Yes.
question. I thank you for it. We have a little bit of fake finger marking, but it's not much. We have the bigger problems are the areas that we can't get into. If we look, they do surveys, quality assessments after the campaigns, and the number of refusals is very, very small. Uh, there are questions and there's doubt sometimes about the accuracy of the reporting. Most of all, we find out the accuracy of the reporting is good. But we also saw, and it was just yesterday, I saw some statistics. While we get very high ratings with the local quality assessments, we're not getting them from every community, any assessments. and we need to upgrade to make sure we're getting them from every community. We know what's going on, but most of all, up in Khyber Pakhtunkhwa (KP), up in Pakistan, there we need to get into every union council, as they call the cities and towns there. We There are some that we don't have access to because there's local officials that use the polio program. It is showing that they're in charge, and to show they're in charge, we'll keep that program out of there. It's totally against anything that helps their kids, but it's a problem. And there's we don't have that much influence with the Taliban in Afghanistan. We we I've tried to figure out how many Rotarians we have in Afghanistan, and I'm guessing there may be 10. They did claim about 35 a couple of years ago, but a lot of them left when the Taliban took over from the former government. And even those the clubs, they do some good activities, but it's a handful of people who represent us there, and that's a bit of a challenge. But for the most part, we think the programs are honestly run. The woman in Pakistan who actually heads up the program, she's very well respected. She was just in a meeting in Cairo. She's there now in the last couple of days. That's assessing polio progress in what they call the Eastern Mediterranean region. It's in a different area than the Sara region that India's in. But there seem to be good people running the program who put children first, and that's what it's all about. Thank you.
Yes, sir.
Moving on to the next question. There is a question. In addition to Pakistan and Afghanistan, are there few cases traced in USA? Is it? They're
Yeah. In
asking if
addition,
there are cases traced in USA.
yeah, I showed that slide of where the different cases are. Places like Chad, Sudan, South Sudan, Benin. There's been a couple. Cameroon. There's been a couple. Niger, Nigeria. For a while, we had them in the northeast region, in a place called Borno. Now we're getting them in the north west region, in Sokoto State and a couple of the other states. And in each case, it's basically governments that are against the general rule of law. They're individuals who tend to be, uh, they love their children. They will tell you they love their children, but they take actions which don't necessarily reflect that. And they're doing better. In fact, polio's funded through Rotary's funded a couple of additional positions in that area to try to help bring it about. And in Benin and Cameroon, we give grants to the Rotarians there to help put on activities which indicate support. Unfortunately, and we do have some work being done in Ethiopia, but in the rest of Horn of Africa, polio Rotary is just not a player in those areas. We were helpful. There was a polio case that was not indigenous to Africa in Mozambique and Malawi. There were, I think, four or five cases about 3 years ago. And fortunately, as a result of the investment of Rotary, the investment of the Gates Foundation, and others, and the good work of the governments there, and UNICEF and WHO, we were able to totally close that outbreak in Mozambique and Malawi. So where we do have issues, there were ways to solve it. I would mention in Mozambique, they believe that case came from Lahore in Pakistan. So it just shows how someone flies somewhere, someone goes somewhere, and if you don't have strong immunity systems, people will come down with polio.
Yes,
Thank
Abdullah.
you.
Moving on to the next question, sir. We have a question asking what technologies or strategies are being used to improve early detection of polio virus.
Yeah, there's a couple of things. Let me talk about innovation first, when we already know that there's a virus or there's a potential. Years ago, maybe seven, eight, nine, the Rotary funded through PolioPlus dollars research into using fractional IPV doses. In other words, you'd have a vial, and while you change the needle on the end, you could give what instead of a full dose, you'd give like a fifth of a dose. And they found out through extensive research and analysis and field testing that you could do those fractional doses, and they were just as effective as the full dose. So as a result, that innovation has saved quite a bit of money, and it's also sometimes helped us with a limited supply of vaccine. We also developed something through funding and research up in the Netherlands, something called novel oral polio virus, or NOPV2. And that's the vaccine of choice now in most of the countries where IPV just isn't possible, and it's been very successful. It's helped to reduce the incidence of spread. It's a very stable vaccine, and it's been it's worked very well. The I should like say is that last year, and this doesn't include India, the polio program, the Global Polio Eradication Initiative, of which Rotary again was the founding partner, immunized children a billion times. It was about 467 children, but some of them were done more than once. But it was about a billion times we immunized children, and there've been tons of innovations in terms of logistically, operationally, through how refrigeration is accomplished, how the telecommunications, the radio communications, the listing, the handheld. If I can talk to this group in India on my phone like this, it just shows what is able to be accomplished and what can be accomplished through innovation and activities. Vaccines, by the way, the oral polio virus. If you look at the vaccine itself, it costs about 14 U.S. cents. I don't know what that comports to the rupee, but and if you look at all the cost of the paying the stipends for the frontline workers, paying for the UNICEF social mobilization, paying for the vaccines themselves, paying for the cold chain, the transportation, it's $1 uh, per vaccination. So when every dollar that's donated, or the equivalent of a dollar, will ensure that one child is vaccinated. So and that's Rotary tries to raise $50 million a year. We do. That's matched 2 to 1 by the Gates Foundation, and then the trustees of the Rotary Foundation, because of the support of Rotarians around the world, are then able to fund the equivalent of 150 million doses a year. We fund roughly 15% of we, meaning Rotarians, of the effort to eradicate polio. Plus, we're instrumental in getting the U.S. government. We're instrumental in getting other governments. So if you look all in of the resources coming in, excluding the Gates Foundation, Saudi Arabia, who's now given 100 million, which they're independent of us, our advocacy or whatever. We're responsible for funding about half of the total cost through advocacy or through our own contributions and our Gates match. We fund about half the cost of the worldwide effort to eradicate polio.
Thank you, sir. We have a question for Mr. Vinod
Yeah.
Saraogi. How can Rotary clubs at the district level continue supporting awareness and immunization even after eradication?
It's actually sensitization through social media, and actually explaining to the audience that till the last child becomes polio free, or the world becomes polio free, the risk of having polio virus once again enter India is there. And because it's prevalent in the neighboring country, a very access to India is possible. So the effort of Rotary in India and the clubs has to be continuous. The surveillance has to be continuous. Any case detected should be reached out immediately to find the cause and find an end to it. So we are very aware of the importance, and we are very aware that Rotary has to play a big role till the last child is becoming polio free. Yes, Athira.
Got it. Thank you, sir. Uh, we have a question asking, can you share examples where local leaders or have played a role in increasing coverage, vaccination coverage?
In India, do you want a reply from India, Atira? Okay. Local
Yes,
leaders,
sir.
the local leaders like Dr. Hande, H.V. Hande, he was a pioneer to support the polio vaccination in Tamil Nadu. And Tamil Nadu was one of the pioneering countries. He was the health minister, pioneering state in the country where the polio vaccination started. So we had once we have explained to the even to the present health minister, when we have explained the importance of how to keep our children protected, the importance of immunization, the polio drops, uh, they are all welcoming because the whole idea of keeping the children protected from the crippling disease is well known to most of the politicians as well, and every hospital and every doctor is willing to support the case. So it's not a difficult matter to convince the political will in support of this polio eradication.
Thank you. So, and there's a question open to both of you. How can we explain this slightly, but I'll repeat the question again if you have more to add. How can surveillance systems be strengthened to ensure early detection and rapid response globally and in Indian context?
Can you repeat it, Atira? Can you repeat the question?
Yeah. So, how can survey? Can you hear me, sir? How can
Yeah,
surveillance systems be strengthened to ensure early detection and rapid response?
it's actually reporting of any incidents across India from any public health center or hospital or doctor who would have identified a case of a virus, and immediate action being taken towards it is the only solution, preventing the spread and keeping the child in isolation if a case has appeared. I think that vigilance on part of the health department and the doctors is very important to keep this under check.
If I could add to that, I think Governor Vinod is exactly right. And looking at more of a global perspective, and particularly in the African countries, what we did some analysis and we found out that kids that were having signs of acute flaccid paralysis, they weren't always getting the medical attention that they needed, but they also weren't having their fecal samples taken. And then once they were, they weren't getting immediately sent to the laboratories. We're funding 165 laboratories around the world, and it doesn't do that kid any good, but it doesn't do any kids any good if it takes 6 months to have a case identified. And that's what we just had in Yemen. We had, for because of instability, the samples weren't leaving the country. They weren't getting to a lab. It's actually done up in Pakistan in that instance, and we just had, a couple months ago, a huge spike in reported cases of polio variant cases that were from 2024. And we were getting them 6 months later. Well, meanwhile, the virus is spreading. People don't know that it's spreading. And, the immediate action isn't needed. So surveillance is crucially important. And it needs to be done quickly. And, I heard a report yesterday. They claim it's working, a lot quicker. But I think it's something that there needs to be a lot more focus and attention on. So whoever asked that question, I think, is knowledgeable, and I praise them for being knowledgeable of the importance of surveillance and asking the questions that need to be asked.
Moving
It
to
goes
the
back to
next.
that accountability that we need accountability
Yeah.
from our partners, and one of the places we need accountability is to make sure that yes, the initial surveillance takes place, but also that the follow up happens quickly.
Absolutely. So, moving to the next question, there is a question about conflict, asking countries Afghanistan and Pakistan uh, are often dealing with conflict, and is this one of the reasons for not effective immunization? Is conflict a reason for not effective immunization?
Yeah, Atira, conflict prevents
If that is,
the health workers reaching out to the child in the remotest corner. So when the campaign of immunization goes around, if it is a normal country, we can reach every child in every corner. But during conflict, the health workers would find it a big challenge on their life and to reach out to them.
It's thank you, Governor. I think it's important that Rotary can't just do polio. We need to do polio, but we need to do the other things. And one of the important works that's done through the Rotary Foundation of the Rotary Peace Centers, and there was just one opened in Uganda a year or two ago. There was one this past year in Istanbul, intended to serve the Mid East, and there's another one coming up relatively soon. But it's if there's Rotarians who are interested in making endowments to the Rotary Foundation. We've had quite a few Indians doing that. I would encourage them to look at the peace and conflict resolution area of focus of Rotary. I would encourage people to look at the sanitation and literacy and all those areas. And we do accept large contributions as well for polio, but we need to do those other things. We need to be sure that and as the governor mentioned, militancy. It's if we didn't have the militancy that we've had, Pakistan and Afghanistan would have soon followed India as being polio free. But it's because of that, the political instability, the militancy, the unsafe conditions in the neighborhoods that's why we don't want polio done.
Yes,
thank you so.
Atira.
Yeah, we have some great questions coming up, but we have to slow down since we are out of time. But I would like to take this one question about how does the science behind polio teach us about preventing other outbreaks? What does polio teach us about other outbreaks?
Your question again?
What does the science behind polio teach us about preventing other outbreaks?
Oh, yeah.
I briefly, it's mass vaccinations. It's getting to the masses. It's getting to the individuals. In the case of the oral polio vaccine, it's getting it's getting to as many as possible. But the other major move we discussed uh, innovation is we need to reintegrate the polio program with all of the other immunizations. India's done that. They took the polio components, they moved it into what they call the expanded program of immunization, and now there's what they call a hexavalent vaccine that's giving like I don't know if I got my numbers right, like 7 vaccines at once. They're getting the polio vaccine. They're getting the diphtheria and the measles and the rubella all in the same vial at the same time. And in the end, it's for people to take up vaccines, it's got to be convenient for them. It's got to be easy for them, or it's got to be mandatory. And they follow the mandatory. But it's that the changes of making the delivery systems much easier for people, much more welcoming, much more acceptable, in the sense that they're getting value for the money. There is some polio hesitancy. Polio is not my area. Why do I need it? Well, if you're giving it with the other vaccines, those questions tend to disappear very quickly.
Atira,
Thank you, sir. Yes.
one survey what we are doing is we are doing the cervical cancer vaccination in our district 3234, and we have met with good success. We are doing lot of education of the girls and the parents, and now this has become a big thing in India and especially in our district. We are doing a lot of cervical cancer vaccination. So we have learned from the polio vaccination the importance, and now we are doing it for the cervical cancer vaccination, and it is preventable.
Absolutely. Thank you, sir. Thank you for that. And we are coming to the close of today's session with that. My heartfelt thanks to our distinguished speakers, Rotarian Vinod Saraogi and Rotarian Michael McGovern, for their insights and commitment. And on behalf of the Hindu and the Rotary District 3234, thank you all for joining us. Have a wonderful evening.
Atira, my last line. Let's
Yes,
make
sir. You may
history.
add.
Let's make history. Let's end polio forever.
Yes, together we end polio. Thank you for inviting me. And again, I apologize for the technical difficulties, and but we got through it.
It
Yes.
was
Thank you,
wonderful.
sir. Thank you. Yes. Thank you for that.
Thank you.
Thank you all.